Hi, this is Bobby KIMBROUGH, and welcome to Off the Cuffs. I'm excited to have with me world-renowned, my friend, Dr. Oil, the infectious disease expert from Bowman Gray Baptist Hospital. Welcome back, Doc. Glad to see you again. Glad to have you here.
Hey, it's great to be back, Bobby.
Yeah.
Think about you every day.
Yeah, I appreciate that.
I'm not sure that's a good thing or a bad thing, right?
Yeah. I got a lot of questions for you. So
Shoot.
Last time we talked was last year. Last time we saw each other was last year. COVID hadn't hit as hard as it has hit. I saw you've gotten the shot. So I want to walk backwards. So I saw that you got the shot. Tell me, what's behind it? How do you feel? And what's the percentage? I hear a lot of conversations in the barbershop what people are saying about the shot.
Yeah, so, well, first of all, there's a lot of COVID around. And
I see the numbers.
The numbers are high. And the stories that I hear, is people like, what was I thinking? I got 20 family members together over Christmas, and then I got a phone call afterwards, and now my mama's got it. And, so that's sort of the background. The shot is our ticket out of this. And
really?
Yeah.
So why do you say that?
Yeah, I say that because, we need a heck of a lot of immunity in our population to slow this virus down.
Okay.
So it's kind of like if the virus is going on a mud run, and there's a few things that can make that mud deeper. One thing is more people get infected, masks, social distancing, that makes the mud deeper. But getting vaccinated makes that mud really thick. And really thick as well as deep mud, the virus just can't slog its way through. And that's what we're trying to do with immunity. The more people who get the shot, the more immune the population is, the virus is going to slow itself down. So that's one thing. The second thing is that to protect you. So if you get the shot, and
I haven't gotten it yet, but go ahead.
Yeah, we're going to talk about that. but everything, if you get the shot, and and if you're not immunocompromised or have serious medical problems under it, 95% chance you're going to be immune afterwards, which means you're not going to get it. And if you don't get it, and then when you go home, you're not going to give it to your wife.
I don't have a wife yet, but go ahead.
But or your kids, or just talking in general.
Yeah.
So the more people who get it. So there's two reasons to get the shot. One is to help protect you, a little bit of a selfish reason, and then the other is to help protect the community and society and to get rid of this virus.
So getting the shot makes you immune from COVID?
It does. Yeah, wow. That's what it does. So you get the shot, and then your body builds antibodies, and antibodies are proteins that then attach to and neutralize the virus.
So do you know how to get the shot every year?
We don't know that yet. Right now, you get a 2-shot series. Huh? Yeah. Well, we haven't been given the shot for a year.
Well, that's true.
So
that's true. That's true.
You don't know until you get that far out. But if you get 2 shots, the studies show both of the vaccines that are out right now, 95% efficacy, 95% protection.
Wow.
So that in the shot world is fantastic. I mean, the flu shot's only 65%. And that one helps us. So this
is 95, what you say?
95.
95%?
Yeah. That's what the studies show, yeah.
A lot of people are leery of taking that shot. A lot of people in the barbershops say, they don't really know enough about it. They're experimenting with us. Does the shot really work? And so, I've seen a lot of people take the shot. I saw the incoming president-elect take the shot. I saw you take it.
Yeah.
And I was like, wow, okay.
Yeah, right now, so we've given to about probably a little over 10,000, almost 11,000 people at the
here in Forsyth County?
Just at our medical center.
Oh, at the medical center?
Yeah, because we'll talk about priorities in a minute. But the doctors and the nurses and those people taking care of people, they're on the first list. So we've had quite a few get it already. Here's the thing. So the shot actually, here's a story about the shot. So this is a little bit new technology that we use, and it's technology that actually people have been working on for about 15, 20 years. So it's not just something we dreamed up, and we had it ready to go for the flu this year. And what it is there's a little construct of messenger RNA, which is the blueprint inside the virus that tells the virus how to make proteins. And so we had built this for the flu, and it was all ready to go, and they were starting to get ready to test it for flu this year in clinical trials. And then COVID came around. So the two companies, Pfizer and Moderna, said, you know what, let's take that messenger RNA for flu out of there, and we're going to put in COVIDs. And so it was ready to go. And it only took a month or two to do that. So that's why the vaccine came out so quickly, is because we had all
See, I never knew that.
Yeah, we had all of the machinery around it. So, it would be kind of like, you build a house, and then you put a pedestal inside the house,
right?
And then you decide at the end, well, let's just change it out. Take that pedestal out and put a different one in the house, and it's ready to go. So that's kind of what happened. So the trials, that we do to make sure that the vaccine works and safe, actually were done with the exact same number of people that we do with every other vaccine we have. Tetanus shots, you name it.
Wow.
And so the same number of people, but we just, there was a lot of interest, so there was more money available to recruit more people faster. But it's the exact same number of people. And because there was so much COVID around, we were able to test it quicker, right? Because
right.
you know how well it's going to work based on how many times you protect someone. The more of it's around, the more you're going to know. And then the safety trials that came out of it, too, look real good. So the vaccine's safe. I'll tell you one thing. You get a little bit sore afterwards.
That's a long needle. I saw that needle looked pretty long.
Yeah, it's not that long. But it's smaller. It's actually tighter. You don't get as much stuff from it. And so you get a little bit sore the day afterwards. And then every now and then someone will get a fever, but it's really not that much different.
How many shots you got to get? 2?
2, yeah. So if you get the Pfizer vaccine, it's 21 days apart.
I'm afraid of
Moderna,
needles.
it's 28. Are you? Well, then don't look. I'll distract you.
Wow. Wow.
Yeah. So, but I'm as an infectious disease doctor, I'm really excited about this vaccine because I know how well it works. And then the other thing is that the safety data is incredibly good. So I'm really confident about it, and I really would encourage people, to really start thinking about getting vaccinated when their priority time comes up.
So how many people in the county have we vaccinated already?
Oh, man, I'll do a little bit of math in my head. Probably.
You said 10,000.
I bet we've probably done, between the county and Novant and us, we've probably, not all of the 10,000 from us were in Forsyth County, somewhere in Wilkes and High Point, but we've probably done, between 15,000 and 20,000 people, I would think. Well, right now, so the first priority group was the healthcare workers,
right,
and then people in nursing homes,
right,
and the people who work in nursing homes. The next priority group we're doing right now are people over the age of 75. And there's about 50,000 people in Forsyth County who are over 75. So we got a few people to vaccinate. And the supply is a little tight right now because
that's what I heard.
The companies are making it as fast as they can, but they're having to distribute to every state, and then every state has to send it out to every county, and then every county has to split it up from there. So I think by the time we get into the next month, supplies will be a lot better. I'm looking for law enforcement to start getting vaccinated maybe in early February.
Early February?
Yeah.
Someone else told me that.
Yep.
I think Chantel told me that.
So, yeah, I think I talked to Chantel about that. Yeah.
Yeah.
So,
February.
Yeah.
Wow. So, a lot of questions I hear people talk about, the pandemic. A pandemic means that's a worldwide problem, right?
Yeah, that's right.
And so the disease has affected not only the general population, it has affected the hospitals, it has affected the jails, it has affected all of us. And so the truth of the matter, none of us are immune from it, right?
No, I'm afraid that everyone is at risk to some level.
Wow.
But yeah, you're right. It has affected everyone, and I bet right here, as we talk, when people start thinking, I bet they know somebody. I bet they know somebody who's had COVID. for their family. And there's
We've had quite a few people
even
here.
know people who've passed from COVID now. So yeah, it affects every one of us. It's something, and the vaccine can help you through that, and help you and your family and the people you're around. You know, even after vaccination, for a while, we're still going to have to mask, and we're still going to have to distance for a while because, you know.
What's a while when you say even after the vaccine?
Yeah, well, the while's a little bit up in the air, probably until summertime at least, late summer.
So you think we'll be back to normal in summertime?
I think back to normal. I'm starting to look maybe at getting into the fall time as being more back to normal. I think Thanksgiving and Christmas next year will be a lot more fun than it was this past year. Yeah.
What about the summer? I need a vacation.
Yeah, you and I both need a vacation.
I'm telling
Where
you.
are we going to go, Bobby? We got to
You know
start
what?
planning.
Anywhere. Just somewhere where the phone don't work. You know,
Yeah, that's
where I don't
right.
have to answer the phone.
You know it. Yeah, I think this summer some travel might be more easy. I don't know exactly yet how much air travel is going to be coming back or international travel, because the world will be a little bit further behind parts of it. But yes, travel might be better this summer too.
So let's say when it opens up for everyone, when I'm talking about the vaccine, when will that be?
For everyone, boy, well, we're going through the priority list. So, you know, after the 75-year-olds, then it goes down to either 55 or 65, depending on what the president wants, and then people with medical problems, and then after that, it'll be everybody or anybody who wants one. That's probably looking at maybe May timeframe, I would think. And teachers are going to get it right at the same time law enforcement gets it.
February.
And which is important because we want, our teachers want protection in their schools and such. But so we just kind of go through this priority list as we go through. But every time a needle goes in somebody's arm, we're that much closer to getting out of this. That's the way to think about it.
Wow. So the reason I was asking that because let's say like in a lot of counties, 100 counties across North Carolina, you have a controlled population inside of a detention center, right?
Right.
So I'm looking at the lines of going in, offering it to those persons that are incarcerated. I think that would cut down on a lot of the transmission.
Well, it will. Yeah, I think in detention centers, the first order of priority is to get the staff immunized,
right?
So that because as you know, staffing can get tight when you get people getting sick.
Oh, believe me.
Yeah, I know.
Yeah, you're
that.
singing to the choir now.
Yeah, same thing for us in the hospitals. And then after that, we'll be doing the detainees because it's important to protect their health.
Oh, without question, without question. You know, I have that conversation at least 2-3 times a week. You know, matter of fact, I had it last night. You know, people talk about, well, you know, you got a COVID outbreak in the jail. You need to release people from the jail. I don't have that authority to say override what a judge says to release people. I don't even have the authority to decide who gets the shot.
No, either do I technically. I mean, it comes from the governor here in North Carolina.
Yeah, so I tell people we're doing everything earthly and humanly possible to combat the spread of it. But it is a pandemic.
It is. It's everywhere.
It's everywhere.
It's everywhere.
So my prayer is that we get through this, and like you said, that we get as many people vaccinated as possible.
Yeah, and I really do want to emphasize the safety, and then how well it works.
Yeah.
And it's really important.
It's a 2-shot system, right?
It's 2 shots. Yeah. So the first shot gets you going, and the second shot boosts you up.
How many days apart? Is it the same day?
21 or 28, depending on which company shot you get. And otherwise, there's not much difference between the 2 companies.
So you get the shot the first time, and then you come back 28 days later, 21?
Or 21, yep.
For the
boost.
And
you get reminders by email and such when that happens. It comes in on your phone or on your other email. or you can look on your card. You'll get an appointment card that'll tell you when you get the first shot. But yeah, we'll be doing shots here in Forsyth County at the health department, and as time goes on, that shot clinic's going to get bigger. I think we're looking into moving it in a couple 3 weeks into the fairgrounds. And so we'll have a lot more capacity as we get more vaccine. And then people will be able to some people will be able to get it with their private medical systems, either through Novant or through us at Baptist.
So
and
how
we're looking at other places.
Are they
we're
paying
looking at workplaces. We might, if we get it all worked out before, I could bring it down here to Sheriff's Department, and we could do you guys.
Well, I remember before I retired with the government, they would give us the flu shot. They would come over to the building, the Biltmore building in Greensboro, and they would administer the flu shot. Blue Cross Blue Shield would come over there and administer the shots right there on site to us.
Yeah, as we get going, those opportunities I think will be available for all the workplaces. Wake Forest University, a lot of people work down there.
Yeah,
Reynolds, America.
So when I think about how large this county is, right, fourth largest county in the state, you're talking about approximately 400,000 people reside in this county.
It's a lot of people.
That's a lot of people.
So you see the logistics on this.
Right. When you said it, that's the first thing that came to my mind. Yeah. The logistics just in this county alone, talking about trying to vaccinate approximately 400,000 people that reside in Forsyth County.
It's formidable. I can tell you one thing that's really important to me, and that's really important to the county and county government, is we want to make sure that our historically marginalized populations and people who have less access to health care and have to get out and work, may not have as much time to just run out and get vaccinated. We want to make sure that they all have
So what's
access.
The plan for that?
Yeah, so we first of all, geographically in Winston, we want to make sure that the east side of town's got as much vaccine going on as the west side of town. That's one of the reasons for doing it up at the fairground. Transportation's easy, a lot of bus routes in and out of there, and it's close. It's close to everybody.
Right.
And doing it through the health department there. We also want to reach out through the communities and through faith and through podcasts such as yours, and really reach out so that people understand how important it is to get vaccinated and how safe it is, so that they want to go do it. And I think you're going to see vaccine centers open up throughout that area, but people just got to talk about it. It's when I see my the cashier and my at the cafeterias I'm checking out at the hospital, and they say, "Dr. Ohl, how are we doing?" I say, "I think we're doing great." And I said, "By the way, are you thinking of getting the vaccine?" And they say, "I don't know, Dr. Ohl, I'm not sure yet." And I said, "Well, let me tell you about it." And talking it up and getting the information out. It's an opportunity. Anytime you have that opportunity, we take it.
That's so true. Because see, you just educated me on something. When you talked about this is not something that they just whipped up in the laboratories in a week or two. It was something that was already in play for the flu. They just removed a certain, what you said, coating?
It's called a messenger RNA. It's the coating. Yeah, it makes the protein.
Makes the protein. You removed a certain coating out and put it in. And I say that because, in the barbershop, we talk about everything A to Z, life. And a lot of
sounds like we go to the same barbershop.
Yeah. And the guys in the barbershop would say, "Kimbrough, you getting the shot?" And I was like, "I hadn't gotten it yet." And, then it becomes a debate. And I said, "Well, I don't know if I really want to get that or not." And I said, "Well, what do you think about it?" And they said, "Well, do they really know the effects of it, the cause and effects?" And it gets a real heated conversation going sometime about getting the vaccine.
Yeah, well, next time you go down to the barbershop, tell them that you and Dr. Ohl had a long conversation about it, and he assured me that it works and that it's safe, and it's our ticket out of this. So
that's the ticket out.
It's the ticket out. It is
95% chance, right, that you won't
get it afterwards.
You won't get it afterwards.
That's pretty good odds.
Them good odds.
Yeah, I mean, if that was a lottery, I'd buy that ticket.
Oh, yeah. Them odds better than Vegas than the lottery. 95% chance. Yeah. Doc, I know you've been busy. Every time I see you all over the place. Well,
you let me know what I can do, and I'm more willing to help. And when law enforcement comes up, I'll be calling you. Yeah, because I want to give you your shot.
Okay.
It's a deal. We worked it out here.
We worked it out. You give me my shot.
If we weren't distanced, I'd shake your hand on it.
Listen, you give me my shot. I'll go for that.
All right. It's a deal.
Deal. We got a deal.
I'll talk to Chantel. We'll
we do it. Got a deal. Well, Doc, I know you're a busy man. I know you're going from here to there. I want you to know how much I appreciate you, how much we appreciate you here at the Forsyth County Sheriff's Office, how much the county appreciates you because, I mean, you're in the thick of things. You're not vacationing. You're not hiding from it. You're right here with us dealing with it.
Yep.
And that means a lot to me and everybody else. And you truly have educated me on this piece today because I guess it's my ignorance as well. I was wondering, how did they come up with it that quick, too?
Well, now you know.
Now I know. I had no idea it was something that they had been working on for years, and the coding is different. But then that's why you're the expert and I'm the lay person. I get it. Yeah.
Well, thank you for your kind words. I could return it.
Those are just truth. Those are just truth words.
All of to all of our first responders and our people who are keeping us safe. Law enforcement and fire and all of our public safety people. We appreciate you guys.
Yeah, I appreciate them too, Doc. I do. I was telling some of the people at the detention center, I know that it's been rough, and I appreciate what you do. I was telling some of the people in patrol, communications all over the building, you just constantly having a talk because people risk their lives every day when they come in here with the COVID running rampant. And sometimes people say, you know what, I don't know if I can go on the pressure of the psychological effect. I have truly seen the psychological effect of it. And what's been amazing to me is that I've known several people that have contracted it, and each one of them have responded differently. I know some that was up and running a week or so later. I know some that still haven't got up from it.
Yeah, that's the problem. It's COVID. That's the signature, man.
Yeah.
Tell people, though, once the daffodils start coming out and azaleas blooming, it's going to start getting better, slowly but surely. And right now we're in the worst of it.
We're in the eye of the storm.
We're right now, yep. And but once spring starts coming around, it's going to start getting better. And we're over halfway through that. I can see the finish line. So
that's encouraging. When you say that, that's encouraging that you can see the finish line.
We got a little running to do yet, but it's out there. It's out there.
Well, Doc, I'm not going to hold you any longer. I know you got to run. I appreciate you coming by to be with us today on Off the Cuffs. And as always, your words of encouraging inspire this community to see the finish line. We're almost there.
Great.
Thank you, and we love you.
Anytime.
Thank you, sir.